Worldwide, about 1 in 5 people experience chronic pain. That's a shocking amount of people in the world if you think about it. And yet there's so little known about chronic pain, why it affects the way that it does, and why it affects certain people and not others. What are the actual methods to help relieve and resolve chronic pain? Hi everyone, I'm Elaine Ouyang. I'm a certified yoga therapist and I merge pain science with yoga therapy to bring you practice and education so that you can rise above your symptoms, become more resilient. In this video, I'm going to briefly go into a summary of what we do know about chronic pain or persistent pain as of now. I've also linked some more resources below that are examples and studies from leading pain researchers from across the world. Now, before we dive into this video, make sure that you subscribe to my channel because every Sunday I come out with a practical or educational yoga therapy video to help you manage your symptoms and become more resilient. First of all, chronic pain, now more accurately described as persistent pain, is pain that lasts more than 3 to 6 months. It can start from something like an acute pain, like an accident, a tissue damage, a surgery, maybe after a stressful event or viral infection. If the pain lasts beyond 3 to 6 months, it's categorized as persistent pain. When pain becomes persistent, there are actually multiple things that are changing or are changed in your body, from your physiological functions to the way that your neurotransmitters and your nervous system are working. And because of these physiological, biological, and chemical changes that happens when pain persists, we now know that pain is not always a good indicator of tissue damage. Oftentimes, there may not even be tissue damage, but the individual will experience a lot of pain and significant amount of pain. Now, why does pain become persistent, and why does some acute pain become persistent pain and not in other circumstances? No one really knows exactly for sure, but scientists are hypothesizing that things like traumatic events, stress and life-altering events, viral infections, your mood, your emotions during that time, your environment, your culture factors, your conditioning, society factors, your diet, your physical activity or inactivity, and even more can affect how your body changes at the cellular level that dictate whether or not it becomes persistent pain. Since there's so many factors that influence and change pain, we can also use all of these factors to reverse that. So as you can see, pain is very complex. It's multidimensional. It encompasses more than just the physical aspect of the body, but encompasses even the emotional, mental, and spiritual aspect. One thing that most researchers do agree on when it comes to the treatment of chronic pain is to regulate the nervous system so that it doesn't get irritated and get stuck in the sympathetic state as much. Now, just as a reminder, the sympathetic nervous system is the fight or flight response. When we're agitated, the muscles get tense, our blood pressure rises, blood sugar rises, and that's usually when inflammation occurs too. So we don't want to get stuck in that state for too long. We want to introduce more the parasympathetic state, the rest, digest, and relax response of the body, where muscle tension can relax, breathing becomes more regulated, heart rate decreases, and inflammation goes down. The more that we can train our bodies to come into that parasympathetic state using evidence of safety in our environment, using gentle movement and mindfulness practices, the more that we can actually manage pain and reduce flare-ups. As a yoga therapist, what I offer is a holistic and complementary approach to conventional pain management. With yoga therapy, I teach you how to move with more ease while staying within your safe boundaries so that you don't irritate your body and you don't irritate your nervous system more. It will also help you manage stress better, increase resilience, and all of that ultimately means more resilience to your pain. While I cannot guarantee that yoga therapy is the holy grail to managing pain, it will help you move better. And with that, you will be able to perform your daily activities and errands with more ease and feel a little bit more like yourself. When you can feel a little bit more like yourself, life gets a little better, life gets a little easier, and that feeds back to a positive feedback loop in soothing your nervous system in that parasympathetic nervous system state, reduce inflammation, and reduce pain. So where can you start? Glad you asked. I have a pain care yoga starter kit free for you, and you can download it in the link below or over at my website, elaineyoga.com. What's included are 5 daily and short practice videos that include mindful movement, breath awareness practices, and relaxation techniques to help you get into the relaxation response, reduce inflammation, and increase resilience. So make sure you get yours today. And if you have any questions, feel free to email me at elaineyogatherapy@gmail.com. Again, be sure to subscribe to my channel because every Sunday there's going to be a new video for you, either educational or practical video to help you manage your symptoms and become resilient. Take care for now, and I'll see you next time.